So we will be talking about herd immunity. Before that, we will talk in brief about immunity. So if an individual gets infected with an infection, or if he gets vaccinated for that particular infection, he will develop antibodies against that infection, and these antibodies will help that individual to fight that infection, and we say that this individual has immunity for that particular infection. In similar way, if group of people develops immunity for a particular infection, we say that this population has herd immunity for that infection. So this immunized group of people will act as a barrier and will not let the transfer of infection from infected individual to uninfected individual. So you can see in this figure there is chain of infection. If there is no herd immunity, then there is a chain of infection because of which the infection spread rapidly, and if there is herd immunity, then this chain of infection is broken. So the elements which are contributing to herd immunity are first, occurrence of clinical and subclinical cases. So what does that mean? That means if group of people develops infection which is clinically significant, then if they get treated, then they will be having resistance for that infection. They will be having antibodies in their blood for that infection. Similarly, if if you will find subclinical cases, then they will be also having resistance for that infection. So the second element is immunization of herd. So if there is immunization campaign and if lot of people gets vaccinated during that campaign, then the population of that area will be getting herd immunity for that particular infection. And the third element is herd structure. And what does this herd structure means? This means composition of herd. Herd structure depends upon many things like birth, new births added to the population, deaths, and also if some new individuals come into the population and some individual will go out of the population, that is immigration and immigration. Based on that, herd structure will be depending. So actually it's not 100% possible to get herd immunity in a population, but it's believed that if we will keep on developing herd immunity with the help of vaccinations, then we will be able to eradicate some of the major infections. For example, diphtheria and poliomyelitis. The occurrence of diphtheria and poliomyelitis has been limited because of this herd immunity.